nervous. Welcome to the Be Mobile Show. It is Alicia and Brody, and today we're talking about rotator cuff tears. So we're going to get to the nitty-gritty of what that actually means. If you have a rotator cuff tear or any experience with that, pop it in the comments and we will have a chat about that.
We sure will. Now, Alicia, two mafia hitmen were walking through the dark forest one night, and one of them, you know, they're big tough guys, but one of them said, I got to admit, it's a little bit scary walking in this desolate forest at night. And the other one said, you think you're scared? You must feel bad for me. I got to walk home alone.
That is actually a good joke, Brody.
I stumbled on that one a bit. There you go.
No, I liked it. That was a good one.
Look, I'm not a professional comedian, but I do know a lot about rotator cuff tears. So hopefully I'll redeem myself in the upcoming chat.
Yeah, so should we start with having a look at the rotator cuff? Let's bring up the anatomy. Let's have a look at the muscles that we're actually talking about, the 4 rotator cuff muscles.
Yep, so 4 muscles in the shoulder. You can see there's some on the front, some on the back. Basically, they all attach to the shoulder blade and run out to the top of your humerus, your upper arm bone. And you can see they kind of circle all around that humerus. There's kind of one on each side almost. And together they have a pretty important role. People might think of them as being involved in rotation, as the name suggests, which is true. They do generate a lot of rotational force, but really they're active in any movement of the shoulder and the arm, and they particularly provide a lot of just dynamic stability and control. So you pretty much can't move your arm without your rotator cuff muscles being active.
That's right. They don't exclusively produce rotation. They're involved in every shoulder movement.
And we can talk about the different names of them, but it's not that important. The supraspinatus, which runs along the top, you can see it's the top labeled one there, is what people most often will know about or have heard about or have heard they've had a tear in their supraspinatus. But yeah, you can see all the other ones there, the names of which aren't super important, but that's it. That's the sort of general anatomy of the rotator cuff.
Indeed. So the thing is, rotator cuff tears, they're very common.
Extremely common.
They're extremely common, and especially as we get older. So the interesting thing is, though, that most rotator cuff tears are not symptomatic. They don't lead to shoulder pain.
Yeah, and as you get older, you're more likely to have a tear, but it's more likely to be asymptomatic, meaning no symptoms. So this graph shows it here. The biggest risk factor for a rotator cuff tear is increasing age. You can see people in their 50s, 60s, 70s, and 80s, hugely increasing proportions of people with rotator cuff tears. The darker grey columns down the bottom half-ish are the symptomatic ones, so people that have pain or loss of function. And then the lighter grey on top is the asymptomatic, so no pain, no loss of function, no real issues. And you can see for someone in their 80s, something like 10 to 12% symptomatic, but another 20+% of people will have asymptomatic, no symptoms with their rotator cuff tears. So they're really common and they're often asymptomatic.
And in those instances, the people with those asymptomatic rotator cuff tears wouldn't be aware that they even had a rotator cuff
because there's no symptoms.
tear, because they're not going to go and get it checked out.
Yeah. Okay, so really common and often asymptomatic, but sometimes they do hurt. Sometimes people have shoulder pain, they go for a scan and it says there's a tear there, there's something torn muscle, torn tendon. And those terms understandably sound a little bit scary. It's not nice to think. Or
very scary.
Yeah, potentially very
scary. Super scary. You think if your muscle's torn, what does that mean for my shoulder?
To have something inside your body that's torn, that must be pretty catastrophic and pretty bad. But the good thing is, these tears, you might think of it as like a tendon or a rope, like a rope that's been cut in half, but that's not actually the case. These tears are much more like a hole in a blanket rather than a rope that's been cut. And so I'll show an example of this here, a couple of different images showing some different types of common looking rotator cuff tears. You can see, both of them pretty similar. It's sort of like a hole in the tendon that might be full thickness, it might go all the way through. But these tendons you can see are quite flat and wide, like a blanket or a sheet of paper almost, with a hole in the middle. But you can see that the whole tendon, the whole blanket is still pretty much intact. A blanket with a hole in it still works pretty well as a blanket.
It can keep you warm, and in the same way,
Yeah.
that rotator cuff can still function. It can still perform its functions, its movement. It's keeping your shoulder stable.
And this is the vast majority of rotator cuff tears are going to look like that, especially the ones that are not related to a specific traumatic injury. So if you imagine someone has a large catastrophic injury, they fall over or fly off a push bike or something, land on their arm, and then they have a big symptomatic rotator cuff tear after that, that's a very minority cases. The vast majority of people with these rotator cuff tears just had shoulder pain that came on gradually or developed after a milder activity, like they were gardening or did paddleboarding or something, and they've never done that before, and the next week their shoulder was really sore, so they've had a scan and then it's ended up like this. And this is the most common type of tears by far.
Yes, so we have a question here from Leslie asking, does it affect the neck? So do the rotator cuff muscles affect the neck? So the rotator cuff muscles just produce movement at the shoulder. They don't produce movement at the neck.
Yeah, and with any type of pain, any type of musculoskeletal pain, it can sometimes refer into another region or spread into another region, but typically that's more likely when it's a joint problem. So something like in the shoulder joint might refer pain down the arm or up into the shoulder, something like osteoarthritis or frozen shoulder that's really affecting the joint. I would say it's probably possible that a rotator cuff tear pain could spread and refer outwards or refer pain into the neck.
Potentially,
but I think
you're going to feel the whole region may generally feel tender, but it's probably more likely that your neck, you can have referred pain from your neck into your shoulder.
Yeah, I think
that would be a more common scenario.
Yeah, definitely. I think it's unlikely that a rotator cuff tear pain would present predominantly as neck pain. The opposite, as Alicia was just saying, is often true and more likely that problems with the cervical spine, the neck, can refer into and present as shoulder pain, but that is a much less likely scenario. So interesting question there, Leslie. Thanks for that one.
Okay, so surgery.
Yeah.
Is it necessary? Do we need surgery when it comes to rotator cuff tears? The answer is that in the large majority of cases, no. Yeah. It is not necessary. And do you want to go into the details of this study? Because it's very interesting. Yeah.
So you might think if the rotator cuff tear was like a rope that had been cut, then it would need to be reattached. And for those full ruptures, often that is the case.
But they're only a very small percentage.
Yeah, for most of these rotator cuff.
So that would involve an acute injury where you're having a full and complete tear.
Yeah, so for most of these rotator cuff tears, as we said, the thing's still intact. And if surgery was going to be helpful, repairing that tendon was going to be helpful, we'd expect to see better outcomes, but that's not really the case. So this study we've got on screen, you can see it's called What Happens to Patients When We Do Not Repair Their Cuff Tears. It's a 5-year follow-up of a study of people who were non-operative treatment of rotator cuff tears, so did not have surgery. And these are those full thickness tears. It's not just a little bit of fraying, it's like the full holes in the blanket.
It's the full hole through the blanket.
Yep. And amazingly, 5-year follow-up, 75% of patients treated non-operatively avoided surgery and had a good quality of life, so had a really good outcome. 75%, pretty good. And don't take, just because this study's a 5-year follow-up, don't take that to mean it took 5 years for them to get better. They often got better a lot quicker, but they're just saying even 5 years later, still their outcomes were really good.
That's right, and when you're looking at the similarity in those outcomes, and non-operative management has no risks versus surgery, which potentially carries a lot of risks, it's quite difficult to see what the benefit of surgery in the case of rotator cuff repair would be.
Yeah, and in general, rotator cuff repair surgery has not been found in any studies to outperform non-surgical interventions. So for the vast majority of cases, surgery is not needed and not recommended. Of course, there's always fringe cases, and as we said, a traumatic injury, particularly in someone like, obviously an elite athlete, say a baseball pitcher who has a traumatic tear, is obviously going to get surgery because they want the absolute best chance at trying to get back to what they're doing. But for the vast majority of us, just general people living life normally, it's really not needed. We have this other graph to bring up here, which shows the comparison of rotator cuff outcomes for a group in one of these studies when they compared physiotherapy only to people who had the rotator cuff repair operation. And you can see it is pretty clear that there is no significant difference between those two groups. And what's also really promising about this, I think, is how much both groups improved in the first 3 months. So if we look at the average pain levels during activity of something like an 8 out of 10 pain, within 3 months, both groups, whether they had surgery or not, are down to around a 3 out of 10 pain. And within a year, both groups are at a 1 out of 10 pain. So surgery wasn't better, and happily both groups improved a lot in the first few months.
So their pain and function, or their pain has reduced and their function has improved.
Yeah.
But that rotator cuff tear may well still be present.
Yeah, exactly.
Yeah.
The caveat, of course, as we've sort of mentioned and alluded to, is that large tears that occur due to an acute injury warrant a surgical review. We're not telling you don't get surgery. Obviously, that's a decision for a surgeon to make, an orthopedic specialist to make, reviewing your scans and your symptoms and stuff. But we're just pointing, and some rotator cuff tears should get surgery, but we're just really sharing some of this stuff as an example of the fact that you often don't need something to be surgically repaired or for it to be healed necessarily to get a great outcome, because our bodies are really quite good at healing and repairing and recovering and getting back to normal on their own anyway.
Yeah. Okay, so we have a question from Norma saying, is this similar to frozen shoulder? They're actually quite different conditions. So the rotator cuff, they're muscles, so they're muscular structures, whereas frozen shoulder affects the shoulder joint itself, the glenohumeral joint. And frozen shoulder is characterized by a lot of shoulder stiffness, very, very limited range of movement, and a lot of pain.
They can present very similar in the first few weeks. People with frozen shoulder are very, very often misdiagnosed, often with something like a rotator cuff tear is what they're told in the first few weeks. But after 2-3 months, it becomes very apparent which are rotator cuff tears and which are not, because with frozen shoulder, that really passive stiffness that Alicia was just referring to would set in. If Alicia has a rotator cuff tear, it might be painful, but I can usually move her arm like this, full range of motion, pretty normal.
But I wouldn't be able to do that myself because it would be too painful. But if I had frozen shoulder and Brody tried to move my arm, it would just appear really like stiff. It was frozen, like really stuck.
So they are quite different conditions,
Okay, Helen has a question about, will a pop of course of cortisone in there help? We are going to
Helen. We're going to get to that in a moment.
Yes, that's on our agenda.
But we will definitely address that. Great. Few other comments, just people saying hello, Helen and things saying hello, Sarah saying hi, Heather, hi everyone, Val Korma saying hi, I made it. And great, no other questions there to get to.
Thank you for joining us.
Okay, so moving on. So hopefully we've convinced you that a torn rotator cuff isn't all doom and gloom. We mentioned that physio or exercise is pretty helpful, so let's get into that now. So exercise is a really effective way to manage a rotator cuff tear. Yeah,
and the thing is that we know that any shoulder exercise is going to be helpful. It doesn't have to be specific. So a lot of people know, that standard, external rotation exercise that is specifically working those external rotator cuff muscles.
What about your experience, Alicia?
Well, when I swam competitively when I was younger, I had a lot of shoulder pain in my right shoulder, and when I went to the physio, I had to do very specific exercises targeting my rotator cuff. I would get a face washer and have to hold it against the wall and slide it up and down. And as it turns out, that exercise was no more beneficial than pretty much doing any other shoulder movement. And so we have some research to back that up. We're not just making things up here. So this great study, this systematic review with meta-analysis, which is like, the top tier gold standard for research, found that there's no evidence to support the use of specific exercises compared to just general shoulder exercise. So anything that's just generally working the shoulder, moving it, attempting to get it stronger, strengthening exercises, whatever you can tolerate, is going to be helpful. You don't need to do lots of very specific niche exercises. Yeah, and I think what you just said then, Brody, that word, what you can tolerate. So if you do have a painful shoulder, it's going to be a matter of finding what you can do and then progressing that slowly and building upon that. Yeah. If anyone's read the title of the study there, they'd see that it says subacromial impingement syndrome. It doesn't say rotator cuff tears, but they are the same thing within this context. They fall under umbrella. We don't really use the term
term subacromial impingement anymore, but it still comes up a lot in the literature, especially with a study like this where they're looking at a lot of older research and compiling it all together. They call it that because that's what a lot of the research called it. We don't really use that term, but it is what we're talking about. It is the rotator cuff tear type pain that we're talking about here.
Yeah, and there's a study that shows even doing one exercise can be enough to make a difference.
Yeah. This was quite amazing. So this study just got people really simple home program of just doing one exercise. They just picked something that was a bit painful for them. It was the direction of pain that they could tolerate. So for many it was a rotation like this, for some it was out to the side like this, or a lifting forward. They got them to do it with a small weight or a resistance band and just said, do this 3 sets of 10 to 15 reps twice a day for 12 weeks, and found that even that was enough to make a really big difference in people's shoulder pain levels. So again, it doesn't have to be fancy. You don't need to do 15 different hyper-specific exercises. Just doing something, moving that shoulder, ideally progressing it a bit if you can as you get stronger, is going to be a great option.
It sounds overly simplistic.
It's almost too simple,
doesn't it? But that is the truth, and that is what a wealth of research backs it. You know, the main takeaway is move your shoulder in a way that you can.
Yeah. So often pain is not simple.
No,
but
there's
often,
there's many factors that contribute to pain.
But often the things you can do to help pain are simple.
Yeah.
We got another question here from Fred, who says, is there a group which this occurs more often? If you've answered, apologies, just popped in. Yeah, so definitely just the older you are, the more prevalent these are for sure. We showed a graph at the start, Fred, which you might have missed. I'll briefly bring back up on stage. Yeah, 50s, 60s, 70s, 80s, these are really, really, really common, both symptomatic and even more so asymptomatic tears. So no loss of pain, no loss of function. They are slightly more prevalent as well in people that do a lot of overhead activity, either for their job or for recreation or sport. People that just use their shoulder a lot more up here are more likely to develop these tears. Again, but not necessarily more painful ones or worse ones, just more likely to have these tears, some of which might be painful, which makes sense. Like if you're going to be using that body part up and doing lots of stuff, working overhead and things, of course, you might be more likely to have some shoulder troubles. Yeah. So thanks for that question.
So when it comes to what exercises you can do, pick what you like, and of course, modify exercises. You know, you might be like doing rows, push-ups, lateral raises. You can still do your banded rotations if that's something that you like to do and feels good. Yeah,
typically people are going to struggle a lot with like lifting out to the side and maybe overhead pressing. That doesn't mean you shouldn't try and do those. It just means modify as needed. You might start doing lateral raises out to the side with no weights and just lifting 20, 30, 45 degrees out to the side, and that's your starting level. After a few days or a few weeks, you can go higher and higher. You can eventually add a little bit of weight, just progress and stick with it, and be patient and just kind of follow that process, and you'll find that often that can make a big difference over the coming weeks and months.
Definitely, and if those lateral raises are super sensitive and really aggravate your shoulder, just leave those out for the time being. Do other exercises that you can, and then further down the track look at reintroducing those.
Great. Bev Demesta's watching. Hi, Bev.
Hi, Bev.
Okay, last little section to cover. Helen asked about it earlier, a pop of cortisone. Do corticosteroid injections help? Alicia, the data says, yes, probably some short-term benefit. So in the first few weeks,
short-term benefit.
There seems to be a little bit of a reduction in symptoms.
But when we hit the 12-week mark, so 3 months further down the track, there's not really any difference between the people that had a cortisone injection and those that didn't. And again, this comes back to what we discussed with surgical intervention. There's risks that come with having a cortisone injection. And actually, it was...
bring this up.
Yeah, we might bring this graph up now.
The text might be a little bit small for some of you to see.
It's a little bit small to read, but essentially that part that's highlighted red said that there's possible long-term harm with cortisone injections.
So this is a sort of a summary of all different types of pain conditions and whether or not corticosteroid injections help. So for those top two is for
I beg your pardon.
For tennis elbow and
not the red, just beneath the red. There's possible long-term harm.
So if we look at the rotator cuff, which is the third line down, it says possible short-term benefit, and then definitely no long-term benefit, and insufficient data yet to say if there's going to be long-term harm. But we are seeing for these things more and more to point to those red boxes that there are some long-term harm. So for things like tennis elbow tendon problems, which is a very similar thing, and for the knee joint osteoarthritis, again, both of those have some short-term benefits, but definite long-term harm for those ones. So for the rotator cuff, we're not as sure. But yeah, the short-term benefit isn't even that concrete. One of the studies said you needed to give 5 people with rotator cuff pain, 5 of them injections for 1 of them to have a good outcome.
Which is not.
So your chances.
That's not a good statistic.
It's not very good, is it? Your chances of getting a good
favourable.
outcome with an injection, not very high. If you do, it's going to be some short-term pain reduction in those first 4, 6, 8 weeks, which might be helpful. But long-term, potentially some risk. So we would save that corticosteroid injection and really use it as a near last resort option. If your pain is just so debilitating that it's really impacting your life, oral pain medication and other strategies that just aren't giving you any relief, then you might try it. It might be worth it for you to get some pain relief. But it definitely shouldn't be a first choice. You definitely should try and manage it with just exercise and just general activity and things first.
Yeah, and that's what the evidence tells us. And would you agree, Brodie? I think in my anecdotal experience, the people that I've seen that have had cortisone injections for shoulder pain, it pretty much corresponds with that. Yeah. Some people might have no effect. Yeah. Some people might have a small improvement that lasts a little while. But I've never seen anybody whose shoulder pain's being cured by a cortisone injection. No,
definitely not.
Yeah.
Just quickly, like what other strategies can you try to help with the pain? Just your simple things like heat packs or ice packs. There's no either or, there's no one that's preferred. At best, they're just going to give you a bit of symptom relief, but can be worth a try. Just general exercise helps. Even if your shoulder's really sore and you can't really move it much, just going for a walk is actually going to be really helpful.
Yeah.
All the other things we often mention that are simple in theory to say, but very hard to actually do, but better sleep, managing your stress, those sort of things can help too. But obviously that's much easier said than done.
It is, but even if you know that in this point in time, you have a lot of stress on your plate, it can give you a bit of hope to know that, when things settle down, that there is also the hope that your pain will improve as well.
Yeah, and just understanding your pain a little bit can help. Maybe if you have shoulder pain and have been told you had a torn tendon, and then you've learned from listening to this that actually that's not as bad as you thought, and that the shoulder can still be strengthened and used and can heal and recover. Maybe that positive message is enough to help your pain and get you doing a little bit more. So that would be our hope for anyone watching this that's going through that. Maybe you can try and do a bit more, and that will help.
Okay, so in terms of announcements, we might bring up this photo of Jeanette. So she's one of our long-term clients, and she's recently moved back to the UK from Sydney.
Yeah.
And this is her tackling a serious walk in the Peak District. Look at that.
No. We're having trouble bringing that image up, so don't worry about it for now. But if you're in the Facebook group, you would have seen what Jeanette shared there, which was very cool. So shout out to Jeanette. We are missing you here at the group studio. Classes.
Okay, do we have any other questions or?
I'll skim through the comments. Ollie, I'm not seeing anything else specific.
Comments, anything else to
Thanks for everyone for jumping in and sharing your thoughts and things in the comments.
Oh, hold on, there's one here from Sarah.
Sarah says, what's your opinion regarding torn ACL healing without surgery? I've been told that with targeted physio, it can heal naturally. Yeah, that's right, Sarah. We used to think ACLs couldn't heal at all, but now there's actually more evidence coming out of people that are managed non-surgically and finding that the ACL actually can heal in some people. Or similar with most of these things, like with torn rotator cuffs, that it doesn't actually need to heal for most people to have a really good outcome.
Good function.
Yeah, and there's always caveats and extremes and yada, 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 and all those things we have to say. But for a lot of people, I'm someone who's had 3 ACL surgeries, repairs, all of which I had between the ages 16 and 20. And in hindsight, if I re-tear it tomorrow, I definitely won't be having surgery. Certainly not as a first choice option. I would try, knowing what I know now with my own understanding, I would definitely try to avoid the surgery. I'd only consider it if after maybe 6 months, 9 months, a year, maybe, I just was still having so much instability, it was giving way on me. But yeah, other than that, I wouldn't be strongly a proponent for it for sure, yeah.
And that wasn't like even a consideration when you had your ACL
No,
repairs?
yeah, I
that
didn't.
you
I was
wouldn't
told there was
repair
no
it?
choice. Yeah. Or I did it 10 months later, redid it, and he's like, well, we got to do the surgery again. I'm like, oh, great. And then did the other one. He's like, we got to do the surgery again. Like, yeah, didn't even have an option. But yeah, knowing what I know now, knowing the evidence that people can have a great outcome without surgery, and that some of them heal, but you don't need them to heal. Yeah, but interesting point, Sarah. Yeah. And then Maria said, still waiting for cortisone shot for calcification since the beginning of the year, but no longer painful. Great, awesome, Maria. Not needed. Injection not needed. Don't worry about it. So that's great. We're happy for you to get such a good outcome.
Great to hear.
Okay, that is it for
All
today's
right.
show. Thank you for watching. Thanks for all your questions. If there's a topic you want to see us cover, you can let us know in the comments and we will add it to our roster for an upcoming show. But otherwise, that's it from all of us, and we'll see you next Wednesday, 4 o'clock, same time, same place.
Yeah, have a good week.